Okay, so y'all, today is gonna be a story time. Yes, I'm in my living room. Yes. Okay, so basically, this story time about to be about how I went to the dentist to get one teeth pulled and ended up leaving with 5. So yeah, I said I went for 1 and got 5 taken out. So first of all, let's get into this bud. Yeah. Anyway, y'all. So this is the one and only time I actually had to call out for work. I've been working where I work now for 6 years, right? Called out one time because my toothache was banging this day. Like, I couldn't do it. So I'm like, you know what? I just got insurance through my job. Let me see what I could do. So I called the people, right? Mind you, I ain't never went to this place before because, you know, I'm a G when I get a toothache. You know, I just put a little remedy on there and just keep it moving, whatever. But this day right here, this day in particular, I don't want to hear nobody talking. I don't want nobody touching me. I don't want nobody doing nothing, right? So I call the people and I'm like, okay, well, what kind of dentist is in my district? Because I need to figure out, like, what am I going to do? Because I can't take this no more. So there's like, oh, we have this place right here, this and this, you can go there. So I looked it up on Google Maps and it was 45 minutes away. So I'm like, okay, cool. So mind you, I called the place and I'm like, okay, what kind of information do I need to know to bring to the place? What kind of paperwork I need, and all that other stuff. So they was like, oh, you just need your medical card, your driver's license, and Social Security and stuff just in case. So I'm like, all right, bet. So I pull up to the place, you know, I already took like an Advil, Tylenol, whatever, for the pain because I'm like, dude, if I don't handle this right now, I'm not going to be able to talk. Like, at this point, I'm shaking. I can't even drive. This tooth is banging, dog, like banging, being so disrespectful. So I'm like, I didn't even do nothing to you. I ain't eat no candy, no ice cream. Like, you know, I ain't eat nothing with no ketchup. So, like, why you acting up today? Usually, you know, we come to the same terms. We like, all right, now, you know, if I eat this piece of candy, we gonna eat on this side, that side. You know, we ain't gonna bother you a little bit too much. Like, I brush you every day and night. Like, why you acting up today? Okay, I'm finna show you. So I get to the place, y'all. I fill out my paperwork. I ain't never been there before, so you know that take a little minute or whatever. Mind you, my appointment was at 8 o'clock. They opened up at 7. I think that's right. They opened up at 7. Okay, so I'm sitting there waiting. It's like 5 people there already. Wait. I'm like, okay, you know, the pain that came down a little bit, so I ain't trying to be, you know, what's the word, impatient or whatever. So I'm like, okay. They calling everybody back that came there after I got there. So you know I'm finna act up. So I'm like, okay, here we go. All right, they don't call people back. I'm like, all right, if my appointment was at like 8 o'clock and all these people just walking in the door after 8, how is they coming in after me? Please make that make sense because I'm okay. So then finally they called one last person. I was like, you know what? I'm finna get up and I'm finna go to this counter and figure out what's going on. So I'm like, yo, like what it is, because I came here, I'm in pain. My appointment was at 8 o'clock. You got all these people coming in after 8 o'clock and coming to be seen, getting called to the vet, and I'm still sitting here. What's up? Okay, we just had to find your insurance and make sure your insurance is going to cover this and that, whatever. So I'm like, all right, bet. Y'all need to let me know something because I'm just sitting here, you know, while everybody else get taken care of and I'm not. So what happened? So I get called to the back, right? Finally, I come to the back. You know, I got to take my tongue ring out. I got to take my necklace off. And I gotta take my belly piercing out because when I went back there, they was like, oh, we have to do an exam on your mouth and, you know, take pictures or whatever, x-rays, and you gotta wear this so you can't have no jewelry or nothing due to, you know, radiation and all that other stuff or whatever. So I'm like, all right, bet. So I take all these things out, do. So we finally, after all that, I'm like, dude, I gotta use the bathroom. Go to the bathroom, get out. I finally get sat back down in the waiting room because I'm waiting on my dentist, y'all. This what really made me mad. So after they called me back there, after I get out of the bathroom, right? They put me in the waiting room again, telling me I had to wait on my dentist because we only had one dental person there, one surgery dentist there, whatever you call them, one surgeon, and all of us. Hold on. Yeah, y'all. So then, let me back this up a little bit. So yeah, so then I go to the back, take all this stuff down. So then they tell me, yeah, it's only one surgeon there, this and that, whatever. So I'm waiting, wait. Now I got an attitude because I'm waiting this long and you telling me, you just not telling me that it's only one person here doing surgery on people? No, ma'am. So, excuse me. So I get back there in the room and I get in my chair or whatever. So then they send somebody in there while I'm waiting on the surgeon to do a gum check. So the lady coming down, she like, oh, I'm just gonna check your gums to see if you have like any diseases and stuff like that. Y'all, tell me why, like mind you, I never had this done before. So I would have been prepared, but I wasn't. This lady get like a pimple popper tool that you like scrape or whatever, like something that you scrape under your nails. And tell me why it's one person sitting at the computer, and then it's her pricking my freaking gums by each tooth, making them bleed. Well, she pricking them to see if they're gonna bleed or not or whatever. And if they bleeding a lot, like you gotta take like some kind of vitamins or whatever crap she was doing. So every time she picked something, and if it bled or whatever, she was yelling at the person that was sitting at the computer what tooth it was in the area in my mouth and was doing that, whatever. So y'all, so after she got done with that, I'm like, this y'all hurt. She's steady scraping this and that, whatever. So I'm like, okay, you know what? Like, I'm getting ready to get violent. Like, it's really irking my nerves. So after she got done with that, she was like, all right, after you're done, I'm gonna get you some kind of mouthwash to make sure you don't get a bacterial infection, this and that, whatever. And I have it for you. I have it ready for you when you get ready to leave. So I'm like, all right, whatever. So then they steady asking me, how you doing? Like, I'm in pain. Y'all steady trying to talk to me and I'm in pain. So something in my eye. So he finally come in there, right? They pull out the x-rays of my teeth and he showed me what's going on. So he was like, what tooth is wrong? So I'm pointing like, oh, it's this one over here or whatever. So then he was like, okay. So he going in, picking around this and that, whatever. So he like, oh, this tooth right here definitely has to come because, okay, y'all, back up. Let's back up. Y'all, there's something in my eye for real. So let's back up. Okay. When he was looking at my teeth or whatever, he was like, oh, the reason why this tooth on this side is hurting is because you still have all your wisdom teeth in, right? So that's one error. He was like, that's probably why this one is forcing this one to come forward, and that's why it's hurting so bad, even though it's still rotten or whatever. So I'm like, all right, whatever. He was like, so what do you want to do? Do you want to pull them out, or you want to leave them, or you just want to pull out the one that's hurting or whatever? So I'm like, at this point, I really want you to pull out the one that's hurting me because the wisdom teeth, they ain't really hurting me that bad. It's really this one that's bothering me. So he like, okay, so this is only a consultation. So we're going to have to set up another appointment for you to come in and get these teeth pulled. So I'm looking at him. And I just, like, I literally had to pray. My body was getting overheated. And y'all, I'm going to show y'all pictures. I'm going to show y'all pictures. I don't know when in the video or whatever. But I'm going to show y'all pictures on how I was looking or whatever. So I like really had to pray. And I'm like, Lord, please don't allow me to be so harsh and disrespectful towards these people. Because, you know, they only doing their job or whatever. But I just really wish that somebody would have came to me and told me that this was just going to be a consultation and that they wasn't going to do anything this day. So I'm like, you know what? All right. Like, I'm snatching the paper or whatever. I get ready to leave. And I'm like, okay, I'm ready to pay and go. Like, I'm ready to clock out, whatever. Like, just call me when I need to come back. So, girl, I didn't even take the the medicated mouthwash the lady was supposed to give to me for my gums bleeding, this and that, whatever. Like, I didn't want to hear none of that, because literally y'all just sat here and nitpicked and picked on my whole mouth just for y'all to tell me that y'all wasn't gonna help me. Yeah, I think it's best that I leave right now. So then they call me, right? So mind you, I had this little consultation, right? Whatever. So then they call me and tell me that they don't have any appointments out till like August. So that was like 2 months out. So I'm like, are you really killing me? Like, are you really kidding me? Like, this is the only distance I could go to. And you telling me that y'all booked all the way out to August? I got to deal with the same tooth by August. That's okay, because I'm going to pull him out, whether y'all know it or not, and then we can figure this out later. Because I'm not going to deal with this for another 2 months. Like, I can't even work. I'm in so much pain. Like, be for real. So, of course, y'all, I didn't pull it out. Because, you know, you could bleed for pulling your teeth out. And you could like, bleed to death and get infections and stuff like that. And, like, all that. And I didn't want that to happen or whatever. So, I just left it in there and I dealt with it. So finally my appointment come. So I go back in there, it's the same thing. You sit down, you wait, you sign in, you pay, you this and that. So I still had to pay co-pays or whatever, even though my insurance basically took care of half of it, whatever. So I go back there, they telling me they pulling 5 teeth, y'all. 5. And then they was like, oh, do you want to be asleep or awake? So before they asked me this, right? So the day of my appointment, before they asked me that, it was a couple that was sitting in the lobby or whatever, waiting or whatever. And I was telling them, like, literally, I've been waiting for like 6 months to come back here and get a tooth pulled or whatever. She was like, that's okay. We've been waiting almost a whole year. We already like $10,000 in or whatever. It was like $7,000. So I'm like, $7,000, $10,000 just to be put to sleep. Get somebody else, because I say, you know what, thank you for telling me that, whatever. She was like, yeah, so if you think you can handle the pain without anesthesia and you could get your teeth pulled or you could get whatever done while being awake, then yeah, because you could save you a couple grand. I said, it will. So I go back there and they telling me, oh, do I want to be put to sleep or I want to be awake or whatever? And I said, I'm going to be awake. They was like, oh, for 5 teeth? Yeah. Yeah, because I can sit through this pain for like 5 minutes, then to be trying to pay y'all $8,000 for the rest of my life. I'm not going to do that. Not for 5 teeth, I ain't. Now, if you finna pull all of them out and the dentures was going to be included, oh, yeah, I pay that. But for 5 teeth, baby. Yeah, go ahead and get that little numbing stuff. Yeah, Y'all, when I tell y'all, I ain't gonna say not to do it, because I just don't believe in paying $7,000 when you can sit through the pain. But baby, the only thing that hurt bad, let me just tell you this. The only thing that hurt really, really bad is when they have to stick you in your gums like 50 million times, definitely on each side for me, because I got all of my back pulled out. For when they stick you with the medicine, the numbing cream, just for them to pull your teeth out. And then actually you can feel them tugging and, you know, making the teeth come loose or whatever. But other than that, like, it was a piece of cake. It was a piece of cake. Yeah, like, it was painful though. It really was. It really was. They was like, oh, don't tense up. If you feel too much pain or whatever, just squeeze my hand or lift your hand and we'll take a break. I said, ain't no breaks. Ain't no squeezing no hands. Ain't no stopping. We finna do all this right now so I can get up out of here. Because the longer I wait and I be weak, I'm gonna sit here longer. And I'm like, nah. So yeah, y'all, I really sat there and got 5 teeth pulled. I got 2 with, I got 4 wisdom tooth pulled, and then I got the 1 rotten tooth pulled on the same side. Yeah. all at one time. Yeah, I did that. And it was so painful. Like, the experience at the dentist office was like horrible because it was like a lot of miscommunication or whatever. And it's like I don't have no choice but to go back there because of the fact that that's the only place that my insurance covered. You know what I'm saying? So I have no choice but to go there. But I tell other people, I do not recommend going to this place or whatever because it was very unprofessional and it just wasn't it. And then, yeah, like, I ain't gonna cap though. I think the surgeon knew that I was like kind of aggravated, so he was like trying to talk to me more and like give me big mama jokes and this and that, whatever. And I was just like, oh, okay. They was like, yeah, you're really tough for sitting here and getting all 5 teeth pulled out, this and that, whatever. They showed me all the teeth that was, you know, needed to get pulled or whatever. And I was like, yeah, I'm just ready to go. Mind you, they was like, oh, you need somebody to drive you here and pick you up because, you know, we don't like for people to leave after they just got a tooth pulled and they can't drive. I'm like, okay. So actually, when I got out, my husband actually drove us, and I got out and he drove us home. And the whole time, I'm just like, I could have drove myself home. Like, my husband had to miss work just to go with me to the dentist, which he really didn't have a problem with, but that could have been avoided for real because I could have just drove myself. Like, I wasn't asleep. I didn't get put to sleep, so I didn't see the reason why I couldn't drive or whatever. But like, y'all, my whole face, everything was swollen. Like, literally, I couldn't eat nothing for like 2 weeks. Literally, what I did eat, like anything that I wanted to eat. But literally, what I did eat, the only thing that I could eat was mashed potatoes and water. Mashed potatoes and drink water. Mashed potatoes and drink water. And literally, before that, I had COVID. So I lost like 15 pounds in like 3 weeks. Yeah. I had to cook my own mashed potatoes, and like, my mouth was so swollen, y'all. I can only open it like this. I had to stick the spoon all the way in my mouth and pull it up just so I can, you know, put it down. And like, you know how y'all ever seen like a baby eat food or whatever, and you just put it on their upper lip or their gum or whatever, and then they do this like that? That's how I had to eat because my whole mouth was so swollen. Like, y'all, I was miserable as heck, but it was definitely worth it because yes, rotten teeth, where, yes. But yeah, so I'm gonna insert some videos and show y'all like what I look like. And I had to wear a mask the whole time because my cheeks was like literally out here and I looked like a chipmunk. And I ain't like that. So yeah, that's really basically the story about how I went to the distance to get only 1 tooth pulled and left with 5. So if you like this story time, please give it a thumbs up and comment down below what y'all like to see. Other than that, don't forget to subscribe and see y'all in the next video.